Bismillahirrahmanirrahim. Assalamu alaikum. Today we are starting renal system and we'll start from the embryology section. In the renal embryology, three main structures are important. These are the pronephros, mesonephros and metanephros. Now these pronephros and metanephros, these will actually appear in the 4th week of development. Okay, while the metanephros appear in the 5th week of development. These pronephros will degenerate. Okay, so they have no any significant remnant. Then is the mesonephros. Mesonephros will actually uh, work as kidney in the first trimester, and later on they will give rise to two main things. One is these mesonephros will form the Wolffian ducts in the male genital system, and second thing they form in the both genders. These are the ureteric buds. So these are the mesonephros. Now coming towards the metanephros, these are actually uh, forming the permanent kidney. And I told you that they appear in the 5th week of development, and now this nephrogenesis process usually completes by about 36 week of gestation. Now let's see how the kidney will form. So see here, we have two main structures. One is the ureteric bud, that is actually from the caudal end of mesonephros, and second one is the metanephric mesenchyme, that is from the metanephros. Due to interaction between these two, it will lead to the formation of kidney. So this ureteric bud, it will lead to the formation of the ureter. Remember all the caudal portions of the urinary tract system above the bladder. These are the ureter, renal pelvises. Okay, so remember ureter, renal pelvises, and then calycis, the kidney, and finally collecting ducts. So from the ureter to the collecting ducts, this system is formed by the ureteric bud, that is the metanephric diverticulum. And these structures will initially will not be canalized. They will be fully canalized by 10th week of development. So if there is any failure in their canalization process, that will also lead to obstruction. Now coming towards second thing, that is the metanephric mesenchyme. Now this metanephric mesenchyme, also it is known as the metanephric blastema. What happens due to the interaction of the ureteric bud with this mesenchyme, it will differentiate into the structures from the glomerulus. Remember the nephron that starts from the glomerulus. Okay, so from the glomerulus through it is having PCD, proximal tubule, and then distal descending limb of loop of Henle, then finally ascending limb of loop of Henle, and then here is the DCD or distal tubule, and then collecting duct. Collecting duct, I told you it is from the ureteric bud. So here these structures up to DCD from glomerulus, these structures are actually formed from the metanephric mesenchyme. Okay, now we are having a look on the theory. What is written here is there about the pronephros, that they'll appear in the 4th week of development and then they'll degenerate. Then is the mesonephros, that will also appear in the 4th week of development. It will function as interim kidney for the first trimester, and it will persist in the male genital system as the Wolffian duct, and this Wolffian duct will lead to the formation of ductus deferens and epididymis. Okay, now the metanephros. Metanephros are the permanent. They'll first appear in week 5th of the development, and the nephrogenesis is normally completed by 36 week of the gestation. Now coming towards how this nephrogenesis occur, that occurs by two main structures. One is the ureteric bud, other is the metanephric mesenchyme. The ureteric bud arises, it is also known as the metanephric diverticulum. It is derived from the caudal end of the mesonephric duct, and this will give rise to the ureter, pelvis, calyces collecting ducts, and this will fully canalize by week 10 of the development. And the metanephric mesenchyme, that is known as the metanephric blastema, it will form the structures glomerulus through to the DCT via the interaction with the ureteric bud. Now we are clear up to these points. They see what is there. Now, if there is any aberrant interaction between these two tissues, that will lead to several congenital malformations of the kidney. For example, renal agenesis, means there will be no any kidney. Okay, and then is the multicystic dysplastic kidney, means it is the dysfunctional kidney. Okay, and other thing that is here, that is uretropelvic junction. Now this uretropelvic junction, here these are, sorry, let me draw this. Okay, so here this is the pelvis, and here is the ureter, and here this one is the kidney. So this junction, it is known as the uretropelvic junction, and this junction will canalize in the last, means after all the other structures are canalized, then this will canalize. So it is said here that it is last to canalize. Hence, if there is any congenital obstruction, that can occur here most commonly. Okay, and if any obstruction occurs here, that will lead to, so obstruction will lead to accumulation of the urine here. It will lead to the hydronephrosis, swelling of the kidneys. Okay, and this this obstruction can be unilateral or bilateral, and it is the most common pathologic cause of prenatal hydronephrosis. This is the important point, that if a scenario comes where they told that we have performed ultrasound of the baby, we have performed a ultrasound for the fetal well-being, and in that renal calyceal system is dilated, giving the presentation of the hydronephrosis. What can be the most likely cause? So most likely cause is this one, uretropelvic junction obstruction. Okay, and it is detected by prenatal ultrasound, as I told you.